Welcome back to Health Bulletin. Join us for another informative episode covering the top 7 latest global medical news, ranging from the China pneumonia outbreak to preventive cancer medicine. Number 1. China gives more information on pneumonia cluster. They say, no unusual or novel pathogens following inquiries by the World Health Organization regarding recent respiratory outbreaks. Beijing attributes the increase in flu-like illnesses to the easing of COVID restrictions. World Health Organization also had requested for more data on the cases. Meanwhile, China continues to urge its residents to take precautions, such as getting vaccinated and wearing masks. Local media had in recent days reported hospitals being overwhelmed. Later on Thursday, the World Health Organization said in a statement that China has not detected any unusual or novel pathogens, and that the increase in respiratory illnesses spreading in the north of the country was due to multiple known pathogens. Since October, northern China has reported an increase in influenza-like illness, compared to the same period over the past 3 years. The World Health Organization said it is closely monitoring the situation and is in close contact with national authorities in China. Number 2. New warning as UK grapples with rapid spread of highly transmissible subvariant HV.1, linked to Omicron. Despite a recent decline in cases, it is anticipated that they will surge around Christmas due to extensive travel by people. The government is urging citizens to remain vigilant. The new strain has also been found across Iceland, Portugal, and Spain. Experts have warned it is also spreading rapidly through France. HV.1 is said to be more transmissible and immune evasive and carrying mutations that could help it avoid being picked up by the immune system. According to experts, those who have contracted the HV.1 strain may experience fever, coughing, tiredness, nasal congestion, and a runny nose. So far, HV.1 cases in the UK are low but will rapidly increase in the coming weeks since the holiday season is around the corner and travel increases. According to Dr. William Schaffner, an infectious diseases expert at Vanderbilt University Medical Center, explained how contagious the new variant is. One of the characteristics of this entire Omicron family is that they are highly transmissible. All COVID-19 variants that have become dominant in the UK over the last year are descendants of Omicron, which began circulating in November 2021. The emergence of HV.1 demonstrates how the SARS-CoV-2 virus, which causes COVID-19, can mutate and give rise to new, highly contagious variants. Number 3. A medical mystery. In the U.S., doctors discovered a fully intact housefly inside the intestines of a 63-year-old patient, whose identity hasn't been revealed, during a colonoscopy. This case represents a very rare colonoscopic finding and mystery on how the intact fly found its way to the transverse colon. Number 4. According to a new study from the University of Queensland, COVID accelerates zombie cells in brain. The researcher said that these zombie cells cause tissue inflammation and degeneration, which increases the risk of brain fog and memory loss. They discovered that SARS-CoV-2, the virus causing COVID-19, infects the brain, triggering cellular senescence, a process that causes premature aging of the brain. In addition, research team has developed new therapies to target senescent cells specifically. They identified 4 drugs that can eliminate these zombie cells: navitoclax, APT-737, fisetin, and a cocktail of dasatinib plus quercetin. They said the drugs rejuvenated the brain and decreased the chance of neurodegenerative symptoms that found in a mouse model infected with COVID-19. However, further research is needed. Number 5. UK has approved a preventive drug for postmenopausal women at risk of developing breast cancer. On November 6 was allow anastrozole to be prescribed for people who haven't yet developed breast cancer but who are at moderate to high risk of doing so. The 2 drugs approved by the U.S. Food and Drug Administration for prevention is tamoxifen and raloxifene. Number 6. In New York, surgeons have performed the world's first transplant of an entire human eye. An extraordinary addition to a face transplant. Although it's far too soon to know if the man will ever see through his new left eye. But transplanting the whole eye, the eyeball, its blood supply and the critical optic nerve that must connect it to the brain, is considered a moonshot in the quest to cure blindness. Doctors said we're not claiming that we are going to restore sight, but there's no doubt in my mind we are one step closer. Number 7. Indian drug companies have, in just 1 year, managed to develop medicines for 4 rare diseases. That cut down their cost of treatment by as much as 100 times. Most of these diseases are genetic and many of the patients are children. These diseases are tyrosinemia type 1, rare diseases are Gaucher's disease, Wilson's disease, and Dravet-Lennox-Gastaut syndrome, which causes complex seizure syndromes. The cost for Gaucher's disease, with Eliglistat capsules, has been brought down from 1 rupee and 80 paise 3.6 crore per year to 3.6 lakh rupees. For Wilson's disease, with Trientine capsules, from 2.2 crore rupees to 2.2 lakh rupees per year, and for Dravet, with cannabidiol oral solution, from 7 rupees 34 lakh per year to 1 rupee 5 lakh. Work is also on to reduce the cost of the one-time treatment for spinal muscular atrophy, the injection for which costs 16 crore rupees.
Thanks for watching.